So, good evening, friends. On behalf of My Retired Life Foundation, we extend a very hearty welcome to you. It's a very exciting and informative program on assessment of health of an elderly in the community. And we have with us a very renowned personality, very young geriatrician with us, Dr. Sachin Desai, who has been referred to us by Madam Vidya Shinoy, who is one of our strong patrons. Dr. Sachin Desai's biodata has already been circulated. But suffice to say that he holds a very high degree. He holds an MBBS. He holds an MD in community, and he is also working as a geriatric department of the community department of the S. Nijalampa Medical College and HSK Hospital in Karnataka. He's also got a fellow of the Geriatric Society of India. He is also an MSc in Dementia study. He has attended several international national conferences. He had got several publications to his credit, and he has got 3 books to his credit. So welcome, Dr. Sachin Desai, and we look forward to an interesting session. Thank you very much.
So namaste to all seniors. I'm really happy to be and feel privileged to be with many seniors who are experienced in their field and who would want to. And I would be very happy to share my my journey through the questions as well as through the work that I was fortunate enough to do from 2011. So old age is an universal. It's universal, and everyone has to age right from the day the person is born uh, to the day to the last day. So it's been rightly said by Sir James Sterling Ross that you cannot treat old age. You can protect it, promote it, and extend it. Now, the talk that I would like to and then put forth is under the following headings. I would like to highlight the important aspects of what are the geriatric giants, which include dementia, depression, falls and fractures, caregiver burnout, and incontinence. So we will address these, and why is it important to address these geriatric giants is what I'm going to highlight in today's session. I'll also be highlighting how we could deal with the pharmacological and non-pharmacological measures at home, and how do we have to monitor these medicines, and what a caregiver has to do at home to monitor these morbidities. Then I'll also try to highlight the social factors, how uh, what are prevalent in these individuals, and then what are the newer initiatives with which we can address these 5 geriatric giants. So we know that India is graying. It's in the form of the age that I'm talking about in the population. Then there are the lifespan has been increasing because of the better health facilities, because of better living conditions, and per capita income that's raised compared to the previous decade, where individuals here have better access to health services and better modern um, facilities that are available, even immunization that's available for the seniors. Now, different individuals age uh, in a different span in compared to the regions of the world. Japan is one where the lifestyle and the geographic location makes them much younger mentally and physically compared to their age. India is also not much behind. There is there are there are newer modalities of addressal like nature therapy, music therapy, intergenerational engagement, where we interact with the grandparents interact with the grandchildren, and then this can prevent cognitive decline. Now, the setting in India is slightly different compared to the other countries, where aging is affected by one of the important factor, where individuals migrate from rural area to the urban area for a better standard of living. And this migration has led to development of nuclear families, and because of which the individual's ability uh, to function, the functional abilities are slightly reducing because there are not much members in the house to address and support the functional decline in the elderly. So these functional include usage of a telephone, then the bank operating the telephone, then going to the bank to withdraw a check or shopping. Then so these are few of the instrumental activities of daily living that we uh, with age would decline. But in the Indian setting, because of only 3 or 4 members in the household, the support to the seniors is slightly lesser compared to the previous generation, where there were joint families and there were a large number of individuals who used to support, and there would be children around who would interact with the seniors and make the environment much more cheerful compared to what it is today. So the reason why I am trying to highlight this situation is this is a common phenomenon in or a common uh, a common aspect that we would see it in this modern day. Now, geriatric care includes large number of issues that have to be addressed. It includes addressing the activities of daily living, instrumental activities. Then the reason why we have to care for the seniors is because it's it's like uh, global, the number of individuals are on the rise, and it's prone that the seniors are bound to have a lower immune responses compared to the uh, adult. So hence addressing the seniors is of prime importance, and we would address them through the diseases or the morbidities that they are undergoing. One, because of the aging process; second, because of the long term illnesses; and third, because of the psychological problems that they are facing. So with the aging process, there is dementia, there is osteoporosis, there is cataract, glaucoma, hearing defects, and incontinence. Then, because of the long term illnesses, there is diabetes, hypertension, coronary heart diseases, benign prostatic hypertrophy in the men, malnutrition, anemia, and frailty uh, in both men and women, and cancers as well, because of which the individual is has to be addressed with lot of importance compared. Now there are also psychological problems like depression, feeling of neglect, isolation, social withdrawal in those individuals who are living in a nuclear family, because there would be a large number of there would be a large responsibility of caregiving, and caregiver burnout would be more in these nuclear families. The reason, they'll have to take care of the child who will have to uh, be addressed based on the schooling, in the early schooling that the child has to undergo. Then they will have to take care of the household course, and then lastly the seniors. So when multiple interactions happen, and emotional disturbances can occur in the caregivers as well as in the senior citizens. Now, what are the geriatric giants and how do we address them? There's dementia, there's depression, there's falls, fractures and frailty, caregiver burnout, and incontinence, which are the 5 predominant morbidities or diseases in the elderly that we will have to address. and this is common to all of the individuals who are aging, and there are large number of risk factors for each morbidity. So I'll just like to highlight what are the risk factors and what are the social causes and how we can address them, staying at home and as a caregiver, and then as a first line for those individuals who are trained after they are trained. It may be a geriatric nursing faculty, or it may be a medical faculty. So I'll be addressing in caregivers perspective. And dementia, the predominant risk factors are the advancing age, and some individuals may also have a family history. There is nuclear families which are generated. There is migration to urban areas. There's isolation, lack of education, and living alone all by themselves. So individuals who are having all these risk factors, then they are prone for dementia. So there are common warning signs that are common to all types of dementias. There are 10 of them, and I would like to put forth the 10 to put forth the 10 the important warning signs. So one, there is memory loss, which interferes with the daily life. Then there is reduced ability to plan and solve problems, which we see in unable to calculate when or pay the person from which they are buying. That's at a shop, or a shop when they are doing a shopping. There's reduced ability to plan and solve problems when they are given situations and they are unable to find a solution for a problem that they used to solve previously. There is a time and place confusion. The individual will not be able to they'll not be aware about the uh, oriented to time or the place in which he is residing. Then there is also a reduced ability to process the visual and spatial aspects, like the depth, the height. He'll not be able to. There'll also be trouble in speaking and writing. An individual will frequently lose things, and he'll have to he finds difficulty in taking judgments or decision making. And then there is social and work withdrawal, and lastly, change in mood and personality. So these are the 10 warning signs that we'll have to be aware of if an individual, these are the early signs of dementia that we'll have to identify if an individual is he is having these signs and symptoms, and we'll have to pick it early to address them. There are also repeated symptoms of dementia, which include verbal clues like where's my wallet, or where's what time it is, and he's not had food, or he would want to have food again and again despite he consuming the meal. So there are also certain behavioral problems like rubbing hands continuously or tapping the feet, which are few examples of repetitive symptoms of dementia. So identifying these is the key, and addressing them early is the key. So related to the staging as well, there is a clinical staging which I would want to, based on the years, 1 to 3 years, 3 to 8 years, and 8 to 12 years of illness, which would be stage 1, 2, and 3 of the illness. Now, there are a few video links which are there, which I had put forth in the presentation, but then I will share them. I'll share this presentation to Dr. Sen, and we could see these videos as well. So the videos include like what's dementia, and then what are the 10 early signs, commonest issues with dementia, how dementia affects language skills, phrases to learn for caregivers, then dementia video changes in vision, late stages of dementia, how to address them. So these are a few videos which are there and which we could be addressing. Now there are there's a plan to address this kind of dementia where Alzheimer's is the commonest type, and there are others, Lewy body dementia and other more clinical types of dementia which we would not be highlighting. 80% of them are of Alzheimer's type, which is a physiological phenomena. It doesn't have any pathological cause, or it doesn't have any traumatic cause or injuries which have caused it, in simple terms. Now, how do we address these situations? As a caregiver, we'll have to check what all medicines he is taking, because there's a criteria which is there in the elderly, which is known as start and stop criteria, and a Beer's criteria. So, as a caregiver, we will have to check the medicines whether there are double doses. If the same content of the drug is is there in the multiple medicines that the individual is taking, to avoid duplication or double intake of the same drug. Now, we can also have a pill box which will give us a reminder to prevent forgetting of the medicines. They would be timed, they would be voice recorded, and they would be uh, the tray would just come out automatically, which is an electronic device which is there in the Indian market now. So important is to avoid uh, double intake of the drug, to avoid forgetting of the drug, and also to see that the medicine is taken at the right time, which could be addressed through the pill box. Now, with regards to the seniors and with dementia and safety at home, now elderly with dementia tend to wander away, and whenever they have gone for a walk, and they would forget to return back home, or they would just wander away from the by opening the door, and we are not able to track them. So wristbands, then the GPS uh, tags which are there, which could be tagged, which would be put on the forearm or on the wrist to the individual, the seniors, could be an important way to address. Then drug box as well is an important component which we can address the polypharmacy or the multiple drug intake. Then regarding the safety measures within the house, there are doors which we need to lock, especially the attic and the garage, avoidance of multiple medication intake, avoiding smoking are a few measures which we can or we need to address as a uh, caregiver. And now there are certain newer medicines as well which are being so adhering to these medical prescription is the key. So the second morbidity that we are going to address is depression, and these regarding the emotional state, regarding the verbalization, regarding preoccupied behavior with somatics, then cognitive impairment and anxiety are a few morbidities that we need to address in the elderly, especially uh, which would lead to depression. Then
You are muted, sir. Dr. Sachin, you're muted.
So,
Going to open a door.
so basically, addressing these issues, we could address the anxiety issues in the elderly, and then, so what are the early warning signs of depression that we need to take into consideration to identify that an individual is suffering from depression? If an individual is having reduced concentration and attention, and he has reduced self-esteem and self-confidence, he's having a feeling of guilt and unworthiness, pessimistic view for the future, and ideas of suicide or disturbed sleep, or also diminished appetite. So this is as per the ICD-10 criteria, which tell us about identifying these 10 symptoms would be the key. Identifying them early and addressing them to the uh, psychologist or the psychiatrist would be the key. Now, there are a large number of risk factors which are there for an individual to go in depression. So, isolation, especially in the nuclear families, or death of the spouse, or there is diminished vision or hearing, that he is unable or she is unable to uh, manage the day activities of daily living and the instrumental activities. Polypharmacy and adverse drug reactions, where an individual has to take multiple medications, and the individual is uh, fed up with taking multiple medications and not showing a good response, when the medicines are not showing a good response. Now, also, when if an individual has loss of income or loss of health, or if he loses the will with the willpower of lacking the purpose in life, then depression is bound to set in. Now, there are also a few conditions like Parkinson's and cancers, which bound to make the individual medically depressed of taking multiple medicines, or uh, so how do we address this issue? It's through pharmacotherapy, it's through nursing care, it's through intergenerational engagement, where where a grandpa or a grandma would interact with grandchildren, and such interactions would help in making the environment happy, and there would be positivity that is there, that is spread through such intergenerational engagement activities. Then there's also digitally, we could address staying from one part of the world to the other part, where the grandchildren could interact at a specific time with the seniors, and then this was very much helpful in the COVID times, where digitally the intergenerational engagement programs uh, were did happen, and the role of the family is very much and the support is very much important, especially the caregivers. So in a perspective where they are addressing multiple jobs, multiple responsibilities, they also could go into a burnout or a caregiver burnout situation. So balancing the professional jobs that they are working with, then at home interacting with the seniors and taking the caregiving by turns would be an important feature. Now, we could address depression also through the medicines, uh, which I would not highlight much, considering the details wouldn't be relevant to all of you. All that is that it would cause polypharmacy if not addressed. So addressing it with the right medicines and avoiding double intake of the drugs could prevent polypharmacy. Now, related to falls and fractures, this is the third common morbidity or the geriatric giant that a senior would go through in his old age. So there are causes which are intrinsic, where because of the diseases or the certain morbidities or the neurological problems, and there are extrinsic factors which we can address. So extrinsic factors are those which include the addressing the ground or the surface which are uneven and slippery, or the loose carpets, or the pathway obstacles in a drawing room, poor lighting, glare from the lamps which is there, which makes the elderly uh, suddenly photophobic, and then he would not be able to uh, see and walk properly through the house. Then low-lying furniture, chairs without arm support, inappropriate walking aids, or inappropriate footwear could lead to fractures and falls. Now, how do we address these fractures and falls? It could be addressed through various. It could be addressed through various modifications in the living room, in the kitchen, in the bathroom, and in the stairways. So, in the living room, we could take out all the wires and the cluttered or the uh, so the mats could be straightened, the furnitures could be, especially the low lying furnitures could be elevated to a height which could be equal to that of the dining table or the drawing room table. Then in the washrooms, they need to have handlebars. Then the floors need to be um, non-slippery, and the stairs and stairways have to be lighted. It would have been very convenient if I could project my slides, but I'm just trying, but I'm unable to do it. Because every detail could be put forth. I don't know, it's not able to. It's a PowerPoint presentation, so that I had prepared especially to highlight. So in the kitchen, anyway, I would try to put forth the points, and then in the kitchen we could keep the utensils at a distance where it could be easily reachable, and then the floors shouldn't be polished, and the appliance cords should be out of the way. And in the stairs and pathways I just mentioned, the stairs have to be painted with radium. The stairway should be painted in such a way that they would be able to uh, and directions have to be put forth on each and every room, including uh, naming which room it is. So all these would be essential features that we need to modify in the house to prevent falls and fractures. Now, there are other measures as well to prevent falls and fractures. So better nutrition, especially the calcium deficiencies which need to be addressed, sufficient vitamin D exposure to the sunlight, graded exercise. This is very important, something different compared to the other physical exercise that we would highlight. Graded is if I am able to walk a distance of 50 meters, tomorrow I would ask the senior, or I would walk, if I'm a senior and I'll have to, then tomorrow's distance would be we would add 25 meters or another. So we would add on to the distance that we would have had in the previous day. So as long as we are able to do it, then it is accepted. If not, then they will have to grade themselves. It has to be down up. So upgraded and downgraded are the two different ways in which we'll have to modify the exercise based on the body's capability to address it. Then uh, getting a medical alert system is also an important feature where we'll have to get ourselves screened every 6 monthly, and an alert on the SMS or uh, on the cell phone would be an important issue. If that's the way we could address this issue. Jiren technology and assistive devices are also another feature where assistive devices would help individuals uh, prevent falls and fractures. So, caregiver burnout is another feature where the individual would be helping, the caregivers would be helping the senior citizen to bathe, to perform their activities of daily living, maybe having food or grooming or wearing clothes. All of these are important features which would be addressed, which have to be addressed, and the caregiver, it's the caregiver's role predominantly. So apart from this, addressing the caregivers issues also plays an important role. For example, financial burden, psychological burden, emotional ups and downs that are there in the nuclear families, where one individual has to care or have to take care of the seniors. Then there would be stress and strain, and there would be a caregiver's burnout. So there are options for senior care in which are emerging in India, which include home care, adult daycare, where only the seniors would be taken to the daycare center, assisted living, skilled nursing facility, and adopting a grandpa. So these are a few senior care options which are available in India at the moment, which are the five key alternatives which can prevent caregiver burnout and burden. Now there were few images of them, and now for the five morbidities, which includes dementia, depression, falls fractures, and frailty, caregiver burnout, and isolation and neglect. There are different ways of addressing this issue. First, we could keep the elderly alert and active mentally by keeping them into active calculations, asking them to have cognitive stimulation exercises like chess, the Sudoku, and all of the games which would help them keep mentally active. Even calculations, for that matter, would be an important feature where which can prevent cognitive decline. Now, educating the caregivers is important, and what are the early signs of Alzheimer's? We would have to uh, highlight or the importance of knowing them, especially forgetting the forgetfulness, then difficulty to perform daily routine, then difficulty to travel, uh, then and not able to connect with the driving and other aspects. Now, nursing assistance is important. Screening for seniors is important, especially with those who show early signs of dementia. Now, related to depression, walking has been shown immense benefits. Yoga, IC activities, keeping the elderly cheerful and enthusiastic, especially with intergenerational engagement programs. These are a few ways in which we could address the seniors with depression. Now, walking, yoga, IEC activities to caregivers, and adhering to medicines like antidepressants, and regularly getting themselves screened using geriatric depression scale would be the key. Now, related to falls, fractures, and frailty. Uh, Frailty is a phenomena where an individual becomes very lean and he loses his muscle mass, and this will lead to uh, kind of a malnourishment in the seniors as well. Now, how do we change this, and how can we prevent falls, fractures, and frailty? Now, seeing that the tiles are rough in the bathrooms, which is the 90% of the individuals, which whoever have a fall, it's in the bathroom, and especially on the wet floors and slippery floors. Creating awareness about having a safe surroundings, especially within the house and outside the house. Then having electronic wheelchairs and wearing shoes which are soft enough and which wouldn't, with a grip, would be beneficial. Now, caregiver burden, we'll have to prepare the caregiver mentally, and caregiving has to be taken on turns. There would also be isolation and neglect, which is there in individuals. So, socialization, having an interactive session, especially during a walk or at the newspaper reading rooms, and uh, going back to the rural area for meeting all members of the family on at regular intervals during their old age would be beneficial. Then developing a home for the senior citizen would be very much beneficial with all these levels of prevention, uh, especially the primordial prevention, where before the risk factors have emerged, we could make the house a senior friendly house. Then primary, where already the risk factors, if they have emerged, like if the individual has developed osteoporosis, or if he has already developed certain diseases which can lead to like the diabetes, where there's peripheral neuropathy, where the nerves, the sensitivity to the nerves is less, and the individual will not be able to appreciate the peripheral senses. So here it is important to see that the morbidities, the medicines are taken at appropriate time, and we could address this issue as well. Now, what are the preventive measures what a senior has to adopt? One is a prudent diet, where large number of fruits and vegetables, reduction in the dietary sodium that's in the salt that we consume, high fiber diet to prevent constipation, foods rich in antioxidants, where we would have uh, garlic, ginger, then aloe, so many other green leafy vegetables and yellow leafy vegetables that we'll have to consume, which we can prevent uh, morbidities arising from deficiency of antioxidants. Now, cycling, jogging, then consumption of the hormone replacement therapy in women during the perimenopausal age group and postmenopausal and menopausal age group would be beneficial. Lipid lowering drugs, immune boosting drugs like vaccines, which are of influenza, pneumococcal, and tetanus, would have immense benefits to all seniors. Now, related to the newer initiatives, there are intergenerational engagement programs. There are newspaper reading rooms. Then there is tea clubs. There is family get-togethers. There are interactive sessions with a grandparent and a grandchildren. Then meals on wheels, home delivery of medicines could be of immense benefit to the seniors. preventive geriatric clinics, which are upcoming in the form of uh, wellness clinics, which are there in the urban area, which is functional, uh, and then mobile clinics, which could help in providing care to the patient at the doorstep, and even the emergency situations, then they could be uh, addressing this situation through health checkups and mobile clinics. Now, there's one dementia elderly friendly community model which is there in the Netherlands, where the whole community is functional and operational, which includes all the shops, the all that is required for a community to have. So it's a model community where it's run by the people who are having early signs of dementia to moderate dementia. Now, severe forms of dementia wouldn't be there. They are just they would be the inpatients of the hospital. But what's important from this model, we could take up this model and replicate it to the in the Indian setting as well, where the whole community could be run by seniors who are healthy, who are having even or those who are having mild cognitive impairment or moderate cognitive impairment. So these are a few aspects which I wanted to highlight, where we could add life to years, not years to life, and we could have a happy and a graceful aging. So addressing these five issues was what I thought was important, because these are the five commonest morbidities and the five commonest diseases that the senior would go through. Now, if there, now related to the questions, I would be really happy to take questions related to what are the queries that each senior would have, or if there are any facilities of knowing any facilities that are there in and around, or what are the options available for healthcare.
Yeah, I think we go for, thank you very much, doctor. I think we'll go for question and answers. People can unmute themselves and ask questions. Please, one by one.
Sir, thank you so much, doctor. You were very meticulous in explaining all this. I have only one doubt. Is herpes or shingles is also elderly disease?
Yes. So individual who is on immunocompromised drugs, or if he is having a morbidity which would affect the immune system, then herpes would be common. There are three different types of herpes. One is on the face, where the trigeminal nerve is affected, and there's herpes labialis. Second one, there's on the chest, where there is known as herpes zoster, and then third one is on the private parts or on the external genitalia. So these are the three different types of herpes which are common in a senior citizen. It is also a morbidity that is common, and there is a herpes zoster vaccine which is there for the senior citizens. I'll just tell you the schedule of when the senior have to take it. It's there in my presentation. And
okay.
So the vaccines are herpes zoster. It's once in a lifetime that the individual can take after 45 years, and it's 0.5 ml given intramuscularly. Just one dose is sufficient, but it's important to take the herpes zoster vaccine, unless until the individual has already developed, then treatment would be the only modality of addressing it. So before the individual, or if we know that the individual's immune status can come down, then or they are in a situation where they can develop the lowering of the immune status, then they can opt for this vaccine. The other vaccines I would also want to highlight, there is pneumococcal vaccine, which is once in 5 years, which is given intramuscularly, 0.5 ml. Then influenza vaccine as well. So now that we know, now there is COVID vaccine. Then tetanus toxoid is once in 10 years. That's also given. So these are the 4 vaccines which a senior would have to take. And there are vaccine advocacy in Southeast Asia guidelines by the Geriatric Society of India. And we could approach the seniors, and then we could get the all details from it.
Thank you, doctor. Thank you so much.
Other questions, please?
Can I ask one question?
Yes, sir.
Yeah. Other questions, please go ahead.
Sanky Agarwal, there's a lot of problem of incontinence actually with the people actually suffering from dementia, Alzheimer and all that, because they are not able to control their functions. So how do you take care of, how does the even caretaker take care?
Huh?
So, could you please, there is a lot of echo in the voice. Could you please ask the question slowly?
Saying incontinence problem,
Yes.
passing urine and passing stool without informing, without any prior information. And sometimes even the caretaker also does not even know. And these flows keep on rolling around in that stool. How do you take care of such problems?
So, like a child where we put a diaper, there are adult diapers which are there, which can be used during the night, during the day, or they could be. But there's one problem that can arise because of using of this diaper. There would be rashes at the side, and then this could lead to infection, like a fungal infection, or because the flora there are they could turn pathogenic whenever urine would dribble or stool would dribble on the skin. So and even bedridden individuals would have a lot of problem, especially.
Yes.
So hence what we can do is an appropriate nursing care is the only key that we could address it. So if for those who cannot address this situation economically, then we could take care of the daycare centers where we could, or nearby dementia care facility where we could admit them and take care till and they could also be begun on anticholinergics. So this is one drug where especially in those individuals who are having automatic dribbling of the drugs, if the person is taking only one, so ideally there are 3 different neurotransmitters in the brain, 3 different chemical structures in the brain. One is the dopaminergic. Second, I'll just try to put forth a few points in the medical terms. Just 3 terms are medical. One is the dopaminergic, one is the cholinergic, third one is the epinephrine, norepinephrine and adrenaline. So these are the 3 different classes of neurotransmitters which are there. So when one is imbalanced, we can add a drug which can balance all the 3. So there is levodopa, there is carbidopa, which is given to Parkinson's patients commonly, who would have incontinence to some time, or there would be pin rolling movements in the hands, or there would be involuntary movements in the hands. So by giving this medicine, we could control the extent. During the night, it could be controlled. During the day, we could ask them to use a diaper. So medicines is the key as well.
Now, as an extension to this question, the person with a Parkinson problem and having a urine incontinence immediately tries to rush out to the bathroom, nearest bathroom, but
and
in this process he falls down.
So
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 how do you take care of how does the
yeah,
caretaker take care of it?
yeah. So being near. So if he is if the individual is having a frequent dribbling of the urine, or if it is not, if it is continuous, then he can have a, there's a catheter which is known as a condom catheter.
Yeah.
So he can use that with a bag, euro bag,
Yeah.
with the body. So that's one way of addressing. And second one is uh, once he is having this feeling of, or the urge to urinate, he can immediately convey it to the individual before it could dribble. So night we are not supposed to give him Lasix, and we are not supposed to give him a large amount of cold water, or so preferably warm water for the stools to move out. And if the timing of taking of the drug is appropriate, then there wouldn't be change in the rhythm of the individual, especially in the old age. So that
Thank
can
you.
prevent. Yes,
Thank you very much.
yes. I've tried my best to put forth with the number of individuals that I have seen, sir. But if there's some point that I have missed, I will definitely read and get back to on this.
Doctor, can I ask one question, doctor?
Yes, ma'am.
Can I ask one question? I just
Sure.
wanted to ask the arthritis problem that elders tend to have. Are there any preventive measures so that the bones keep themselves strong
So
instead of having this?
there is something, there's a condition known as there's an age group known as premenopausal age group. 45 onwards, we'll have to begin the calcium supplementation, not when they are already having menopause. So we'll have to begin 2 to 3 or 4 years prior with a low dose. We are not giving a high dose as what we would give in a menopausal age group. So we would ask them to have a lot of calcium rich foods, ragi malt, then which is healthy, which is not heavy on the bowel, and which would be easily digestible, a large number of fruits and vegetables. So addressing the calcium issue in the before menopause sets in would be an important way to address this. So yeah, so that's the way we would address it.
Doctor, I have one question.
Yes.
It so happens that we get up once in the night, that's acceptable. But the other way is that the pressure, while after the breakfast, pressure goes high and you feel sleepy most of the time. And after a few minutes, it becomes okay when you start having activity. But when there is no activity, there is swelling in the feet, and I don't know what is that phenomenon.
Okay. So what's the drug that so is it for you, or
Yeah.
yeah, so what's the
I've
drug,
been
what's the antihypertensive drug that you are on? Are you hypertensive?
I'm not usually, I'm low pressured, but certain times the upper side goes to 130, 140.
Okay.
Then I lie down
So
for
have
1
they
hour.
given you a tablet which is 5 mg? That's amlodipine?
Yes. Something they gave, but it did not work. Then somebody said that you're having sleep, is not sufficient sleep at one time. That's why maybe I'm off that tablet.
Yeah, so if that tablet is the key, where it's known as amlodipine. So that will keep the blood pressure stable, and that will also keep so that's the commonest what you call the reason for feet swelling in seniors who are 45 and above. So change of the drug would address it within 3 weeks. It should be coming down.
Okay.
So what we can do at home is we can keep our feet in salt water, so that the water would come out, and then so the osmosis process would help it, and we could water would.
So I should not take this Lasix and all, because what I realize it swells more sometimes.
Lasix would again make you. It's an easy option, but it would make you run to the washroom n number of
too
times.
often. Right. Thank you, sir. Thank you so much.
Doctor, can I ask one question, please?
Yes, ma'am.
Yeah, I wanted to just know that where do we find a genuine caretaker because no caretaker, as I have myself undergone so much trouble with this caretaker. Nurse I had kept for my husband, but she was sleeping.
Ma'am, could you just type in your details here on the message, your telephone number? I would just connect you to the individual.
No,
Which
no,
region,
now
which part
I
of the
don't need
region?
now, doctor. I don't need now because my husband passed away. But I had a hell of a time with that that person caretaker who came from an agency. My God, I was crying really. Then I changed under this. Other nurse came from another hospital. That girl was very sweet, very nice girl. She took good care, but then she got sick. She left and went. And then again I had to find another. So like that, when my son was shouting at me, "Mom, why these caretakers are going on changing?" But I said I can't help it. What can I do with that? No. So then another lady came. Then another after 15, 20 days he passed away. But I'm upset with that caretaker. And I'm telling really, it's anyhow we can do ourselves, but doesn't this caretaker, in spite of spending 3,000 rupees per day, doctor, it comes to 90,000 for 1 month. I kept her, that lady, but she gave me a hell. 11 o'clock, she's night, 11 o'clock, she's telling me to cook for her. I said, okay, I can do that, but tell little early. And when my husband is sick, you tell me, how can I cook and how can I do all big items and all that? Na? So, okay, I said, whatever I eat, I'll give you. You can have that. Nahi, mere ko ye banao, wo banao. She used to order like a hotel.
No, ma'am.
I was very
wrong. It's very wrong.
Yeah, I was crying, Dr. Daly. I don't know, maybe that must have affected my husband because when he came to senses, that time he must have seen that I'm undergoing all these troubles. So maybe that has affected him or what, I don't know. I felt very bad.
Ma'am, it's very, not appropriate and unethical of this individual to have done this.
Yes, very much, yeah.
But there are good individuals as well who would volunteer to caregive. What's the newer initiatives that are coming up is adopting a grandpa, volunteering for caregiving. So especially in the schools where it's going to come in the curriculum, where what we have sent it across. What we did as a school project, we adopted the grandpa along the so there's a school here on the left side of the road. On the right side of the road, there's a residential area. So there are 10 rows of 25 buildings each. So it's a planned city in which I am residing, and after Chandigarh. And then what they do there is, in one row of or one sector, what they did, there are 10 children who would go and adopt a grandpa, and as a school program, and then they continuously monitored the seniors who were undergoing different morbidities, and if they required hospital or a daycare, they came and reported to us, and then it was helpful for us. So this is also planned neatly, which we would be doing in the detailed way in the coming days.
No, doctor, as it is, I am healthy. I would have done everything. But that suction and doctor, I'm not a professional, na? So I couldn't do. So I need somebody, doctor, nurse, to do all that suction pump and all that. That's why I had to keep. And then I can't lift him, no? He's quite bone weight hota hai na unka. So I was in very much trouble.
No, ma'am. They had to. So,
any other question? We'll take a last question, please.
Sir, I have a question.
Yes.
Kanavin sir, एक second. If somebody else is there.
Okay.
If somebody else.
No problem.
Anybody else is there? Anybody would like to question? Okay, Navendukul sir, please go ahead.
Sir, I am very grateful to you for the lecture and the beautiful, innovative information. How do we assess ourselves if there was some sort of a tabled system where we could assess and then we could report to a caregiver or MRL or some group of team leaders?
Yes.
A suggestion to help each other. and
Yes.
motivate each other.
Yes.
Thank you.
So I would share one document which includes comprehensive geriatric assessment. So it's just having all the points that we just need to check. Whichever point we are, which we feel ourselves, we would just tick there, and then that specific specialty we would visit.
Thank you.
Yes, sir.
Thank you very much for the innovative idea.
So,
Thank
okay,
you.
Dr. Sachin Desai, I think we had an excellent session. It was a very, very knowledgeable, very informative session. And
Thank
for
you so
such a
much.
long distance, you have taken a session from us. We are really grateful. We're grateful to
Thank
Vidya
you.
Madam
Thank you.
also. I'll convey my gratitude to her. And we look forward to support in future also. I think
Thank
on
you.
what each of these specific 5 big giants of what you call elderly, I mean, say they are all equally important. So probably we look forward to the further interaction. Thank you very much, sir. Thanks a lot.
Thank you, doctor. Thank you.
Thank you, ma'am. Thank you, everyone. Thank you.
Thank you, Doctor.